Look at our value for the money paid against the services we are receiving. Part of it is to look at utilization, part of it is looking at the premium, part of looking at the technologies, etc., etc., etc. It's around, if I'm not mistaken, it's around 10 initiatives, and a lot of work under each initiative. We will not do anything, prompt. We will study it, we will look at it, and we will make a decision after consulting the stakeholders. I hope I answered your question.
Thank you.
I hope.
One last question. Okay.
Hello, it's a question for Mr. Nabulsi again. I wanted to ask if the hard Jawda quality audits for pharmacies in Abu Dhabi had been published yet. And the second question was, I understand the hospital quality indicators are being collated for the first time at the moment, and I wondered also when they were expected to be published. They're quite specific questions, but I just wondered if you...
First of all, what about the pharmacy? I did not get that. What's the question about the pharmacy?
The quality audits, Jawda quality audits for pharmacies in Abu Dhabi.
I cannot answer this because I am not involved in Jawda. The quality indicators, the 19 that I mentioned, it's already, I think, circulated. Did you receive them, Dr. Sami? It's already circulated to the healthcare providers.
Is it public?
I'll be very happy to share them with you. I'll make sure that they will share them with you if they're not already published on Shafafiyya.
Okay.
I know the circular is already out, and I'm pretty sure also they are on Shafafiyya. But anyway, whatever you need, I'll share it with you. But about Jawda, I don't have an answer to that because it's not part of my scope of work, and I don't know anything about it. Sorry.
Thank you, Marwan. Just keep it with you so we can wrap up. Final thought, we've heard for pay for quality, a change of the relationship, the regulator role, final thought on pricing and the payer-provider relationship.
It's very important to talk to each other. We understand that there are issues with the pricing. It's a very sensitive issue. We like to link, the pricing and the level of pricing to a capacity plan, where we need to link the prices or services needed. Today, I see the healthcare provider. They look at certain DRG as profit-making DRGs, and they will provide the services. I'm not saying that all providers do this. And certain providers, they look at certain services, it's not profitable, they stay away from it. It is our responsibility as a regulator to encourage investment in these services by really reviewing
the price
and adjusting to the market needs.
Thank you, Dr. Sharif. Final thought.
Yeah, three main key points to be addressed is, first of all, about the payers. Sustainability, we need to change from the culture of selling products to the culture of selling service, with all the components of the service. Providers, on the same time, we need to work together to start optimizing costs at the optimum outcome without exhausting healthcare resources. So, and we are expecting, of course, from the regulators to back up this plan. And the pay for quality thing that we've been talking about in Dubai or in Abu Dhabi is very ambitious. However, it needs to be a part of a holistic approach rather than a step across the road. And we need to be very clear about what do we mean about quality and where do we want to head up with this pay for quality scheme so that everyone would benefit from the road ahead.
Thank you, Dr. Sami.
I didn't get a chance to comment on pay for performance in my two answers. It's something that we would welcome with open arms, provided that it is a discussion that is led by the regulator, which we view as an impartial moderator, and that the KPIs selected make sense to the patient.
Healthcare is a very sensitive industry. It touches the national and visitors' lives and their children and families' lives. And pricing is a deep sea issue. and those people sailing in it, I'm sure they are preparing themselves for it, but I believe it's going to be quite a journey. Thank you.
Thank you. Dr. Haider.
My final thoughts, I guess, are that these are definitely changing times. And all the stakeholders in the game need to understand that they need to start to change the way they've always done business, and they need to do it differently. Whether we're talking about members and how they see healthcare and the entitlement mentality in healthcare, and how they should sort of use healthcare more sensibly as it starts to become more available to them. Providers, and again, in the same spirit, a lot of the practices, what we've done over the last 20, 30 years, we need to really start to change that culture, move towards quality outcomes and measurement, and understand that it is acceptable to be evaluated based on these. Payers, again, they need to start to really gain more technical capabilities in the areas they're working in, and all of those who are wanting to do health need to really decide that that's a strategic direction for them. Health insurance is no longer a complementary form of insurance, and if I have 1,000 members because I want to make sure that I don't lose my motor and my other types of insurance business, that's why I want to give them health insurance. You need to take it as a strategic direction and decide whether this is for you or not for you. And if it is for you, then you really need to gear up in order to be part of this expanding vision of delivering care to people and be part of that model. So it is a time of change, and as a regulator, we hope to be driving that change in the right direction, but it's a partnership exercise with everyone. We invite everyone to be part of it and to understand the changes required in order to be part of it.
Thank you, Dr. Haider. Mr. Haider.
Basically, as I mentioned, long term. So spend more time in terms of setting the norms with the providers, maybe clinical pathways, agree on protocols, what is the best approach, and we can also shy away in terms of covered, not covered, this should have been paid for, shouldn't have been paid for, avoid rejections. Transparency, as Sami mentioned earlier, and long-term vision for sure. Thank you very much.
Thank you, gentlemen, for your time, for accepting our invitation on this, and for all your valuable insights. Thank you so much.
Thank you all. I thank the esteemed panelists. It was a great discussion. Thank you for the organizers. One last comment. Please, let's try to come back as soon as possible. We're a bit late.